Okay, so on to the third section. I'm going to show you inside this large medical kit, which is this little one here, which is the chest pain, anaphylaxis and hypoglycemia section. So in here, so this was kind of quite stocky to use. Want to get your hands on in an emergency. Kept one EpiPen. To be honest, I'm not sure if I would use an EpiPen for anaphylaxis. I would probably grab this in preference, which is just adrenaline. Mainly because I can, the dosing is, I can give more accurately on a milligram per sort of kilogram basis. I can titrate it more easily. This is also probably a lot more stable in heat. It doesn't tend to discolour like an EpiPen does. EpiPens are very sort of fragile things. You can't keep them in heat. And I'll show you what's actually happened. I took 3 EpiPens with me, not for me to actually use, but to give to people if their EpiPens were used for something. This is how an EpiPen comes. And I don't know if you can see. Okay, so that's the little window here. Here's the little window. And you can see through it. It's actually cloudy. So when you look through there, it's not clear. It's actually gone cloudy. So this one I'll have to toss. And I realised that the one that I kept in here that would happen to it. But what I didn't realise was even the ones that we kept in a better heat control area also all went cloudy. So it's not discoloured. It's not brown or yellow or anything like that, but it's definitely cloudy, and it says discard if the solution is discoloured. So to my mind, cloudy is discoloured. EpiPen's quite easy to use. You know, you just take the little blue thing off and then stab it into the side of the thigh, hold it there for 10 seconds. But yeah, 3 of these, $100 each. No good. But adrenaline ampules, which are much easier. Interesting, I've never seen it. Sterile solutions of subcutaneous or intramuscular excluding buttocks injection. I have to have a read of that. These ones are much easier to store, and as you can see, none of these are discoloured. So, and they seem a bit more heat stable. You just need to obviously draw these up in a more accurate way. So for a person who's actually having anaphylaxis, or for non-medically trained people, the EpiPen's better, but otherwise I'd just go with adrenaline ampules. And obviously in here I had some just little Alka wipes and an intramuscular 22 gauge needle, and 23 gauge, a syringe, and Band-Aid and Alka wipe. Also in here I've got a glucopen. So this is a little hypoglycemia kit, which is available in Australia. So this is just a little pre-filled syringe. It's also got a little needle on the end there. You actually have to make it up. So there's the powder in here, so you actually have to inject the water into this and then redraw it back up. So again, only really people with some form of medical training would find that easy to use, or a diabetic who've been shown how to do it. It's got a little chart in here. But good for hypoglycemia. I mean, the other thing I carried for hypoglycemia was just some glucogel, 6 jelly beans. These obviously rely on someone being a bit more awake. They've all melted in the heat. they'd still be fine to eat, even a bit melted. What have we got here? Okay, so this is also for anaphylaxis. I've got these two, which is just some Claritine loratadine tablets and some dexamethasone. Commonly we use prednisone. Dexamethasone would be fine as well. Just had a couple of leftover tablets. I often have a lot of these around the place from altitude medicine. I tend to buy dexamethasone rather than prednisolone, and so I mean more commonly we'd use prednisolone for anaphylaxis, but as a long-acting steroid, or hydrocortisone as an injection more urgently, and whatever your favourite antihistamine is. And then for chest pain we just had some nitrolingual pump spray, and I've just got some chewable aspirin. So that's all pretty much that I kept in here. We did have some people with some bad allergic reactions. We had 2 people who were read the note on some brownies that were made that mentioned that they didn't contain any cashew, just some peanut in them, which neither of them were allergic to, and they both ate it. And within 15 minutes of that happening, both of them were having quite severe allergic reactions to cashew, which when they checked again, they realised actually was in the brownie. So neither of them, actually, it was interesting, neither of them had brought to their dinner their EpiPens, and so I actually kept, I didn't have this big bag with me, which was quite unusual. It was about 3 minutes away down the road, but I did actually have him just in my own day pack, one lot of adrenaline in there, but I had to send someone to go and get this pack in case either of them got worse. So we ended up just being able to keep an eye on them, and they were just sick and vomiting and had tummy cramps and things, but managed to get away without giving them any adrenaline, which was good. So there we go. So next one's going to be on ENT respiratory, and we've 1, 2, 3, 4. We've still got 5 more sections to go. So I'll speak to you then.